On April 12, 1955, Dr. Thomas Francis Jr. stood in front of the crowded Rackham Lecture Hall at the University of Michigan to announce the results of the much-anticipated Salk vaccine field trial. The massive vaccine trial had been in the works for several years, and the releasing of the results had become a much-anticipated event. Beyond the publicity, however, the trials were meticulously run and represented a major milestone in experimental medicine. The 1954 Salk vaccine field trial was a revolution in vaccine testing procedure. In 1894, the first major polio epidemic in the United States struck Vermont. 132 citizens became infected with the virus. In the years following, more and more polio cases began to appear. In 1916, New York experienced a major epidemic of over 9,000 cases. The turn of the century marked the rise of a new disease that was scarcely understood and seemingly uncontrollable. In 1921, as polio numbers soared, a young politician named Franklin Delano Roosevelt, FDR, contracted the disease and was left with severe paralysis. Despite his disability, FDR continued his political career and won the presidential nomination in 1932. In 1937, with the help of his former law partner Basil O'Connor, FDR would announce the creation of the National Foundation for Infantile Paralysis, NFIP, better known as the March of Dimes. The NFIP would later play a large role in the approval and of the funding for the Salk vaccine field trial. As researchers learned more and more about the polio virus, pressure for a vaccine skyrocketed. In 1935, physicians Maurice Brodie and John Colmer decided to try their hands at making the sought-after preventative. At the time, however, no one had been able to grow polio virus in a laboratory. Brodie didn't let this discourage him, and instead used the spinal cord of infected monkeys to develop his vaccine, developing his vaccine before Colmer. After minimal laboratory testing, Brodie decided the vaccine was ready for human testing. The vaccine was proven less than effective. In fact, the vaccine caused multiple cases of polio, some of which were fatal. The scheduled field trial of the Colmer vaccine was subsequently canceled. The Brodie-Colmer field trial fiasco would not soon be forgotten by polio researchers and would lead to increased vigilance and safety procedures regarding future vaccine trials. The onset of the 1940s marked another spike in polio cases. Between 1945 and 1949, the U.S. averaged 20,000 polio cases annually. The rise in the epidemic numbers and the pressure from the NFIP brought polio to the forefront of many researchers' priorities. Among these researchers was Jonas Salk. Salk had worked with his mentor, Dr. Thomas Francis Jr., on the development of the influenza vaccine during World War II and had developed a deep interest in killed virus vaccines. In 1947, he accepted a research position at the University of Pittsburgh and began work involving the polio virus in 1948, coincidentally the same year that polio virus was successfully cultivated in a laboratory. The young doctor was put to work sorting different strains of the virus into larger categories. Salk quickly completed the virus typing project and used his NFIP funding to explore the possibility of creating a killed polio virus vaccine. The majority of the polio researchers at the time felt that a live weakened virus vaccine would be more effective in preventing the virus, but Dr. Salk felt that after his experience in developing the influenza vaccine, that the safety benefits of a killed virus vaccine would outweigh the slight decline in effectiveness. Using the methods developed by Dr. John Enders, Dr. Salk and his lab staff began the rigorous process of cultivating the virus in the kidney tissue of rhesus monkeys. The vaccine was then killed using a formaldehyde mixture to deactivate the virus. After intensive and rigorous testing of many batches of differently prepared vaccines, Dr. Salk was able to create a batch that he considered to be both safe and effective. The Salk vaccine had been created. Before the NFIP would even consider testing the vaccine on human subjects, Dr. Salk would have to prove its safety. The Brodie-Colmer vaccine testing disaster still haunted many of the senior members of the foundation. If Dr. Salk wanted his vaccine to be tested on children, he would first have to prove its safety to the NFIP. The vaccine's safety and efficiency was first rigorously tested on monkeys. Batches and batches of the vaccine were injected into the continuously observed monkeys. When the vaccine proved safe in the monkey tests, Dr. Salk moved on to testing his vaccine on children who had already been crippled by polio. Testing his vaccine on the children of the D.T. Watson Home for Crippled Children, Salk was able to test his vaccine in children who would have a lower risk of catching the disease, as they had already been exposed to one of the 3 possible strains. When the vaccine failed to infect any of the Watson home children, Dr. Salk moved on to the next stage of testing his vaccine. The next step would be to test the vaccine on children who had never contracted the disease, but the possibility of a massive field trial was still years away. Salk's next move was to test the vaccine at the Polk State School, a home for mentally ill children. It was believed at the time that testing on children whose future potential was already limited was a necessary precursor to testing on healthy children. The Polk School tests ran smoothly. It was time to test the vaccine on healthy American children.